Hey squad, welcome back to the channel. On today's video, we look into the pathophysiology of a myocardial infarction, or more commonly known as a heart attack. Last week, we covered atherosclerosis, which is a major contributing factor to a myocardial infarction. So if you didn't see that video, please take the time to watch that one first. You can click the eye above my head right here. The term myocardial infarction literally means death of heart tissue. You may have heard the phrase time is muscle. This phrase is more specific to a myocardial infarction, but we'll get there shortly. Now let's jump onto the computer and draw out exactly what occurs during a heart attack. Alright guys, so with myocardial infarction, we've already discussed that it's heart muscle death. And we've already said and mentioned that time is muscle. And again, we will demonstrate exactly how right here. Okay, so first I want to point you to the picture on the left here. So on the outside of the heart, we have coronary arteries. The coronary arteries come off of the tip of the aorta just after the aortic valve. Now, typically what happens is per heartbeat, the blood flow goes up and out into the aorta and out through the rest of the body. However, there's just enough blood that comes back down the aorta, just like a backwash would when your kid backwashes into a bottle, right? So what happens is different valves open up and allow blood to go down into the coronary arteries and perfuse the heart on diastole. So what happens when there's a piece of plaque? We've already discussed that atherosclerosis could cause plaque buildup and hardening of the arteries inside different vasculature. Now, what happens if one of those plaque pieces plucked free and then travels to your heart and gets into one of these coronary arteries and gets stuck? Okay, so we're going to say that a piece of plaque lodges in your right coronary descending artery and creates a blockage. Okay, so first we'll say that this coronary artery is your right descending artery, okay, on the picture here to the right. Okay, and we're going to say that here is the piece of plaque that's gotten lodged. Okay, now typically we would have a large volume of blood coming through this artery. Okay, we have blood flow going through all the way through, and it's a large amount, right? It's the amount that is needed to perfuse all of these cardiomyocytes or heart muscle cells, which is why they're striated, right? And in bands, so they have the action to stretch and contract with the beating of the heart. Okay, all meanwhile, this blood is able to perfuse these little guys with O2, right? And they're able to get in O2 and they're able to take away CO2 and other waste, right? They're giving O2 and nutrients, they're taking away CO2 and waste. Okay, now we pop this clot in here. Okay, and what's eventually going to happen is there's going to be decreased blood flow, right? Ultimately, not as much blood is able to get past that clot, right? So you're still going to have perfusion, but you're going to have less perfusion because there's only so much blood flow now getting past this clot. So heart muscle cells are now going to start getting oxygen depleted, okay? And you're going to get your first symptom, okay? So your heart muscle cells are going to decrease their oxygen availability, which is then going to turn into hypoxia, okay? When cells get oxygen depleted, they become hypoxic, which is then going to turn into pain, okay? And when we specifically talk pain in the heart muscle, in the chest, we call it angina or angina pectoris. Okay, and that means chest pain. And this is caused by the sudden oxygen depletion, or that hypoxia of the cardiac tissues, these cardiomyocytes. Okay, so that's going to be your first symptom. So when these cardiomyocytes begin to get oxygen depleted, they're going to send signals up the nerves, okay, to the brain. And they're going to say, hey, brain, we have a problem. Houston, we have a problem. We are oxygen depleted. We can't fix it. You fix it. And the brain goes, okay, I'm going to fix it. I'm going to send messages down to the rest of the body to the first action, right? The brain's going to take action, and it's going to say, activate the sympathetic nervous system, okay? Which is your fight or flight nervous system, right? It's going to say, increase your heart rate, okay? It's going to start to say, increase sweat production, okay? It's going to say, decrease blood flow to non-essential organs. Okay? It's going to say a lot of different things to try and fix this problem that it doesn't even know what they're fixing. The brain is unaware, right? The brain is unaware of a clot, okay? It just knows that these cardiomyocytes are O2 depleted. All right? It doesn't know why. It just knows that they're oxygen depleted. So now, as all of this is going on, right, you're getting more symptoms. You're getting diaphoresis, okay, or that sweating, okay, that profuse sweating, okay. As the blood flow goes from the non-essential organs, you'll start to see that pale, clammy skin, okay. You'll also might get nausea or vomiting, and this is because you're starting to get blood flow out of the gut to go towards the vital organs in this fight or flight. Okay? So when blood is taken away from the gut, you automatically get nauseous. You might vomit at that point. Okay? This angina, because all of these nerves are connected, they're going to start signaling the brain that it's in pain. Which, because these nerves are also connected to different sections of the body, you might also get pain, a referred pain, in your arms, okay, your jaw, your back, okay? You could even have abdominal pain, okay? This is these nerves collecting all these pain signals from the heart muscle, but transferring it into signals that are, carried through the arms and all these different places because all these nerves are connected. So now, as all this is going on, right, your brain is in fight or flight mode to try and fix a problem that it's unaware of. This clot is sitting here and it's getting bigger because the platelets are getting stuck on it, right? And they're forming a fibrin mesh, right? They're doing their clotting factor because they don't know what the heck this is either. And ultimately, they clog this entire artery, trying to help, okay? They create their fibrin mesh, and this becomes one big, giant clot. And now what happens to the blood flow? Okay, now the blood flow ceases. Okay, this blood flow ceases and there's no more perfusion, right? This artery is blocked all the way down to the end of it. Okay, there is no more perfusion taking place beyond this clot. Okay, so CO2 and waste products and oxygen are not getting into the cells. There's no more perfusion. So eventually these tissues, they die. They begin to die off. Okay? They start to have this cellular death. And this is when we start our major infarcting process. Okay? Because heart muscle death is what is called infarction. Okay? These tissues here are now dying because they're so deprived of oxygen, they cannot survive. So they are dying. Okay? And they're going to release into the bloodstream, when they die, they're going to start releasing a protein. Okay? This protein is called troponin. Okay? This is why doctors, when they do blood work at the hospital, they measure for troponin levels. Okay? Because it is a direct link between cardiovascular injury and the troponins. Okay? Only cardiac muscle has troponin. So you're not going to find troponin because you've infarcted your leg muscle or your arm muscle. Okay? So this is why we measure troponin. Okay? So as this continues, more and more cells begin to die off, right? And ultimately, the whole section of cardiomyocytes die off, okay? And what ends up happening is, depending on the thickness, the length of death that allows, okay, you could have partial thickness where it's only a little sliver, okay? And this partial thickness, so we'll do this down here, partial thickness infarct, okay? Those are your end-STEMIs, okay? Your non-ST elevation myocardial infarction, okay? But what happens if we've infarcted full thickness? Okay? So full thickness infarcts. Those are your STEMIs. Okay? Those are your ST elevation myocardial infarctions. Okay? So these are a whole lot worse, right? Those are the worst ones. Okay? Now remember, okay, in 20 minutes, okay, your heart muscle can last about 20 minutes. This is where we're going to start talking time as muscle. So your heart muscle can last 20 minutes of infarct and still be able to regrow new cells after the infarct. Okay, so it's able to repair itself if fixed within a 20-minute window. Post the 20 minutes, okay, the damage is there for life. Okay? It is irreversible. It cannot be fixed. So the last thing that I want to leave you with this time is muscle, in this post 20 minutes, okay? This post 20 minutes, 500 cardiac myocytes, right? Those cardiomyocyte cells, okay, are lost, okay? Lost per second, okay? That is why the fast recognition of a STEMI and treatments for the myocardial infarction are so key. Okay, because remember, you're losing 500 cells per second, and after 20 minutes, those are gone for life. They're not coming back. That infarct is there for life. Okay, and ultimately what might happen is these patients might develop new problems like CHF, okay, or heart failure. So guys, I hope this was a detailed enough example for you to understand why you're starting to see certain actions and certain symptoms within the body when your patient complains of chest pain, pressure, or other discomfort. And remember, the last thing I want to leave you with, and I'm not going to go over EKGs in this, that'll be for another video, but I want you guys to understand when you are asking specifically about pain, always ask a cardiac patient or a potential cardiac patient, do they have any pain, pressure, or other discomfort? Don't just go, do you have chest pain? Because if they have pressure, they're not going to always tell you, oh yeah, I have pressure. They're going to just deny pain, and then you're going to move on thinking it's not a cardiac problem. So always make sure you're asking for three things, okay? You're going to ask for pain, pressure, or I usually ask other discomfort, okay? And that covers all the bases. Well, that's it for today, guys. As always, stay safe out there, and I will see you in the next video.